The motto of National University of Health Sciences from the beginning is esse quam videre, which is to be rather than to seem to be. And that's important to us as an institution.
What I really like about this school and this job is the fact that I get to help someone who's hurting and to get them better. It's very rewarding for me.
I talk incessantly about my passion for acupuncture and oriental medicine. It's heartwarming is the best word to say it.
The process of changing somebody's life and making them more aware of something, or taking somebody who's debilitated or has not been able to get help anywhere else, and you make those changes, it's a very humbling experience.
At National University of Health Sciences, our goal is, and always has been, to create a true medical professional. A person can go to any number of schools and learn to become a good technician, learn how to adjust the spine or place needles into someone. But to bring these things together in a way that we do at National is to make a true medical professional that sees the patient holistically and addresses the patient's needs. In fact, National University has been unique in that we've brought together chiropractic medicine, oriental medicine, acupuncture, and naturopathic medicine in an integrated classroom, so they truly become integrated from the time that they're students.
Collaborative teams of practitioners will be delivering primary care in the future. We're really positioning our students for the future because from day one, they're learning how to have an interprofessional dialogue with people in different programs, maybe headed for different professions.
And so the massage therapy students are working alongside the professional students as well in DC and ND. It became a program which allows our students to practice virtually wherever they want, in whatever setting they want.
Integration at National has been a part of what National has been and still is since 1906. So this is an idea that our students are colleagues within the healthcare field and not competitors.
This is definitely not easy. Being a doctor is a very difficult thing, and I think it's more of a calling rather than just a profession that someone just goes into.
The curriculum here is challenging because you're responsible for someone's healthcare, and that's important. People are going to come to you for help because they're scared and they don't know what's wrong with them. And it's going to be your job to figure out what that is.
And it does prepare us to speak with MDs, DOs, other DCs, who will speak the same language.
At National, early on in your education, they ingrain into you leadership, being on the forefront of research and development, and incorporating science and fact-based, evidence-based medicine into your day-to-day practice. National has a reputation of being very progressive, very forward-thinking, looking at the future of the profession and leading the future of the profession.
We want you to graduate and move the professions forward. We want you to become leaders in innovation and bring our type of healthcare into the forefront of medicine.
Because National has an established reputation, the students who graduate from here will have that behind them. They have that backing, and they have a very strong alumni association. My colleagues who have been here for decades are excellent about keeping connections with their students who have moved into practice all over the nation, all over the world, and they're always happy to connect new students and new doctors with those doctors who are already in practice.
Many of the students that graduate from National have come back and reported that by virtue of their education, they've been able to get positions that were difficult to get because they fit much better into that integrated setting.
A student who has learned a lot of information doesn't necessarily mean they can apply it and use it. And so having a real-life experience in a clinic setting such as what we have at National is a great opportunity.
The opportunities once we graduate are amazing. The fact that I can say on my CV that I've had experience at a hospital is outstanding.
Since I've Coming national, it's totally flipped my view of things. This was what I wanted to treat. I wanted to treat musculoskeletal cases. I wanted to help people with a better jump shot and a better golf swing. And now I would like to treat a lot of other things. I would like to treat the 80-year-old lady who still wants to garden, or the 3-year-old who's having developmental issues.
I feel like I'm walking out with confidence that when I have my patient for the very first time as a practitioner, I already feel secure about that idea.
A student coming to National needs to be tenacious, enthusiastic, because it's not going to be easy. But that needs to be tempered with compassion. Their goal in terms of being successful here should lead towards a compassionate graduate who understands the needs of the patient. And that's what we do here at National.
I am defining.
I am defining.
I'm defining.
I am defining the future of integrated healthcare.